We all know someone who's been affected by this horrible disease, and it not only affects women, but it affects men too. In the studio, we have Dr. Wanda Dyson, founder of Change for Life Medical Spa. You can visit her website at cflwellness.com. And also Brenda Brown is in the studio. She's the author of Words of Love and Life. Then and Now. She will have a book coming out this fall on Amazon. And we also have Dr. Julie Taguchi. She is on the phone with us, all the way from California, renowned oncologist and author of Sex, Lies, and Menopause. Ladies, welcome to Skin Deep.
Thank you.
Thank you.
Can you hear us
Glad to
okay,
be here.
Dr. Taguchi?
Yes.
Great. So we are going to be talking about something that has impacted almost everyone. It's a disease that seems to be getting progressively worse and affecting more and more people, mostly women, but there's some men out there too that are affected by breast cancer. I want, one of you all to jump in and fill our audience in on, the disease, what it does to us, and why it seems to be getting worse. Dr. Dyson.
Good morning, Julie. This is Wanda, Dr. Dyson. How are you?
Very well.
Good. I'm good. My first question is that women are terrified that HRT, that being hormone replacement therapy, causes breast cancer. Should they be?
And before you answer that, Dr. Taguchi, give us just a 30-second background on HRT, hormone replacement therapy, because Brenda and Dr. Dyson and I have been on the show talking about this before. So tell us your take on it. I know you are a proponent of it, right?
I am a proponent of hormone replacement, but of course using bioidentical or using real estradiol molecules and real progesterone molecules. Mm-hmm. Anything other than that is not hormone replacement. It would be drug replacement or drug therapy.
Okay.
So I think that's really important to clarify.
I think so too.
When people talk about hormone replacement, it's a category. And in that category, there are different types of treatments, right? So we used to give Premarin, all these years for women that was a type of hormone replacement, which of course came from a pregnant horse. It was the estrogen metabolites from a pregnant horse. And that's what we used to give women for decades.
And that's what we really should have been afraid of, right? That particular
It was definitely helpful and helped mitigate symptoms, but we're not horses, and so there are many other byproducts in that particular pill. I think Premarin had 17 different types of estrogen in it.
Wow.
And mostly horses metabolites, but it worked for us in terms of symptoms and managing things.
But then later they came out and said something about it causing breast cancer, right? Or I think you and I talked about that before.
That was from the Women's Health Initiative, which you can mention a bit about, and that is what scared women off of hormone replacement therapy.
That's right.
Hormones, period.
Right, yeah, because they said that actually caused breast cancer.
Right.
Okay.
So in the Women's Health Initiative, they did use Premarin. But, Premarin probably isn't the culprit as it was daily progestin. Now, in a normal, healthy human being, we have estradiol as our main reproductive estrogen, and then we have progesterone. Women who are reproductive and make enough estrogen will basically grow and pop an egg, and that egg is what makes progesterone. So those are two hormones that are normal for a reproductive female.
Mm-hmm. Right.
In the Women's Health Initiative, they use progestin every day. And that drug, it's a drug that has androgenic and estrogenic properties more so than progesterone. And so that daily progestin basically blocked out the beneficial effects of estrogen. And the body was never meant to have daily progestin anyway.
Right.
It's a drug.
Yeah.
And wouldn't you say, Dr. Taguchi, that the problem was also taking it orally rather than transdermally, which is through the skin, or intravaginally?
Absolutely.
Okay. All right. That was part of the problem. And we talked about that before, too. So, go ahead, Dr. Taguchi.
I don't know that in terms of causing breast cancer, but in terms of causing other problems,
Like
taking
the blood
oral
clots.
hormones. Yes, they absolutely increase blood clots and inflammation.
So
CRP.
strokes, inflammation, blood clots were the result of taking this progestin that women were given and taking on a daily basis, which is a hormone replacement therapy. They were taking it orally, correct?
But it's synthetic.
It's a synthetic, but it's a drug, basically. So it was causing all of these problems. And so you and Dr. Dyson promote bioidentical hormones, which are natural.
Yes, but again, transdermally and not orally, because even oral estrogen causes the blood clotting problems.
Wow.
And transdermal estrogen does not.
Transdermally through the skin and through the vaginal area, correct?
That would
Correct,
be
correct. Thank you.
Okay, and so that you're finding that that does not result in the strokes and the blood clots that the other hormone replacement therapy, the synthetic therapy, promoted or
Synthetic.
caused.
Yes, synthetic oral, correct.
Okay.
Doctor, I'm currently on the Wiley protocol. This is Brenda Brown, and I wanted to know what supplements could I take along with this protocol
In doing what, Brenda?
to help me to feel better, or to help me to just enhance the hormones.
So that you don't have to worry about the risk of breast
So I
cancer?
don't have to worry about the risk of breast cancer or anything else.
Okay. All right, was that for you, Dr. Taguchi or
That was
Dr.
Dr.
Dyson?
Taguchi.
Or Dr. Dyson, either one.
Or either one.
Dr. Dyson
Either
is
one.
the
That's
one
the
prescribing that.
Go ahead, Dr. Taguchi. You can answer that question.
So a couple things. Number one, I think it's really important to know that women understand if you have breasts, and most women have two, and you have birthdays and you have multiple birthdays, you're going to always be at risk for breast cancer.
Oh my gosh.
Okay, I mean, that's just our innate humanness. Okay.
Okay.
So we can reduce our risk of breast cancer, and we can reduce it by obviously having pregnant. Well, maybe we can't now, but if we educate our population, having earlier pregnancies and breastfeeding for longer periods of time. Those two reproductive factors protect us from breast cancer.
Okay, when
believe
you say,
it or not.
But Dr. Taguchi, when you say earlier pregnancies, because you know now more and more women are having children later in life. Early pregnancies meaning what? In their 20s? And are you saying that if a woman is in her 30s, mid 30s, late 30s, early 40s having babies, that's going to increase the probability of her having breast cancer or getting breast cancer?
Yep.
Wow. Okay.
Well,
You have scared me. I'm about to run out of the studio, Dr. Taguchi, because I have my
Right.
children in my 30s, early 30s.
So you're hoping that if you have babies at a later time in life, that of course exercising, a good diet, keeping your weight down, and hormone replacement can protect you over time. Okay.
Mhm.
So those are the things that we think that we can do to help reduce the risk. So I think it's really important that we know that the first, believe it or not, the highest reproductive risk for breast cancer is having a baby over 40.
Wow.
A lot of
you
women are
serious?
doing that. And if you think about it, menopause, the average hasn't changed in 150 years. And it's, it's about age 51,
Right.
52.
But having a
Your
baby
first-
over the age of 40
first baby.
increases the odds of getting breast cancer.
and how much does it increase the odds?
Your first baby at the, okay, so if you're having your third or fourth baby about 40.
It increases your longevity if it's your later babies, believe it or not.
It increases your life longevity if you have a second or third or your last baby in your 40s?
Yeah.
Wow, this is interesting.
Very interesting.
Dr.
I did that,
Yeah.
Dr. Taguchi. I had one at 19, one at 35, and one at 40.
Maybe you're good.
Okay.
Okay.
But
But I want to know, if you get breast cancer, are you saying, Dr. Dyson and Dr. Taguchi, that you should go on a hormone replacement therapy? Does that help you after you've gotten breast cancer, or are you saying to use it as a preventative?
My interpretation is that I think that hormone replacement, if we're going to live to be 100, which we could, or 120, and we have menopause at the age of 51 or 52, that's
another 50
years without hormones.
Yeah.
Right. So, and there's a lot of degenerative diseases that come along with that, right? Our osteoporosis, osteoarthritis,
right,
and, cognitive changes, etc. So even if it's just, people are afraid of breast cancer, but we should be afraid of a lot of other things like heart disease.
Yeah.
One in two women die of heart disease.
Over the age of 50, right?
Yes, I mean, that's what women die from, not from breast cancer.
Okay, but what I'm saying to you is, if you, in addition to all of those things you just mentioned, if someone is diagnosed with breast cancer, are you and Dr. Dyson saying they should go on this hormone replacement therapy, or is it too late by then? That's what I'm asking.
Okay, so that's a different situation. If somebody has breast cancer, actually, if it's an estrogen receptor positive breast cancer, our current standard of care is to annihilate and eliminate any estrogen in the body for 5 to 10 years.
What does that mean? That sounds like a mastectomy or something, but
Yeah.
It is. It's a castration. It is a hormonal castration for women. That is the current therapy. Now, there are certain breast cancers like triple negative breast cancer that does the estrogen receptor negative breast cancers. Those women can have hormone replacement, and I think they should have hormone replacement.
okay, Dr. Taguchi, we gotta take a quick break. But when we come back, I want to get some more information from you and Dr. Dyson and Brenda. But I want you to pick up where you left off, because I think that's really important for our audience to hear, the differences in different breast cancers and what women should do to help them get better from this terrible disease. But we'll be right back here on Skin Deep on Sirius XM channel 141, HUR Voice. I'm your host, Sharrarne Morton. Listen, I hope you had a chance to visit the SkinDeepBeautyStore.com for all of your organic and cruelty-free beauty, health, and wellness products. By the way, you can hear this show and all other shows if you go to SkinSoDeep.com, SkinSoDeep.com.